Hello, my name is Jimmy M, and I will be inserting a nasal gastric tube. I have verified the physician's orders and indication for the NG tube. I've gathered my supplies. I have gloves, 14 French NG tube, 60 milliliter syringe, lubrication, tape, pH strip, specimen cup, emesis basin, towel, water with straw and suction setup and safety pin. So I am going to knock knock, come in the door, close the door, draw the curtain for privacy. I'm going to perform hand hygiene. I'm going to put on my gloves. Okay. Hello, sir. My name is Jimmy. I'll be your nurse today. Can you please verify your name and date of birth? Okay, great, Mr. Pembroke. Can I see your wristband? Okay, so I verified the patient's identity. So your provider has ordered a nasal gastric tube. The tube will go through your nose into your stomach, and that will remove gastric content and allow your bowel to rest. Do you have any questions before we begin? Okay, great. So what I'm going to do is I am going to raise the bed to a safe working height. I'm going to position the patient in a high Fowler's position and to assist with the insertion. So I'm going to start by placing the tube in the basin of warm water to help it be more pliable. I'm going to drape the towel over the patient. Okay. And then I am going to use my pen light. Okay. Can you please look up for me? So what I'm doing is I am inspecting the nares for any obstruction, redness, swelling, or deformities. Please cover one nostril, breathe in and out. Okay, cover the opposite nostril, breathe in and out. Okay, it looks like the right side allows for more airflow, so we will go ahead and use that side. So what I'm going to do, I'm going to take the tube, I'm going to measure from the tip of the nose to the ear and then down to the xiphoid process, and it looks like it is around 55 centimeters. So I'm going to get a piece of tape and I will mark that. Okay, so when I insert the tube, I'll have you look up. When it reaches the back of your throat, tuck your chin to your chest. I'm gonna have you take small sips of water. Each time you swallow, I will advance the tube. If you feel like gagging or have difficulty breathing, please raise your hand and I will stop. So I'm gonna start by lubricating the tip of the NG tube. Okay, and please look up. And I'll start inserting, and then once it gets back to the oropharynx, I'm gonna have you tilt your chin into your chest and take some sips of water. So if the patient begins to gag, I'll pause the advancement, allow the patient to take deep breaths, small sips of water, and before I begin advancing. If I encounter any resistance during insertion, I'll stop, withdraw the tube, I'll re-lubricate it, and attempt insertion into the other nostril. Okay? If there's any signs of respiratory distress, such as coughing, difficulty breathing, I'll stop the procedure immediately and withdraw the tube. So I'm advancing the tube about 2 to 4 inches each time the patient swallows. Okay, good. Keep swallowing. Keep taking sips. Good. Keep swallowing. And then once I reach the marked point at 55 centimeters, I am going to temporarily use some tape to temporarily hold it in place while I check for placement. I'm gonna take the 60 ml syringe. I am going to draw between 5 and 10 mLs of gastric fluid. And then I put it into the specimen cup. I will take the pH strip and dip it in there. And the pH strip should indicate between 1 and 5, and that'll indicate that it has placement in the stomach. I'll also maintain an x-ray to confirm placement before initiating the use of the tube. So now that it's there, I'm gonna secure the tube permanently to the nose, the bridge of the nose. I'm gonna split the tape so I can put the main part to the tip of the nose, and then I'll wrap one side in one direction around the tube, and then I'll wrap the opposite side in the opposite direction around the tube to secure it in place. I'm gonna use a safety pin to secure it to the patient's gown, so to make sure that it stays in place. Then I am going to connect the tube on low continuous suction. The tube is patent and functioning properly. So I'll continue to monitor suction output, including the amount and the characteristics of the drainage. And then after that, we're all set. I'm gonna remove my gloves, perform hand hygiene, and then I am going to put the bed in the lowest position, locked, and then I will place a call light within reach. Okay, so please let me know if you experience any discomfort, like nausea or difficulty breathing. And then I will now document the procedure, including the placement, findings, and patient response. Okay, thank you.